Your Excellencies, members of the Fourth Estate, ladies and gentlemen, it is with great pleasure that I present to you the third annual Africa Malaria Progress Report that provides progress on how countries are implementing the flagship campaign of Zero Malaria Starts With Me. Ladies and gentlemen, the fight against malaria was in 2020 threatened by the coronavirus pandemic, especially here on the African continent. The pandemic disrupted our health systems, it slowed down economic activities, and increased vulnerability for large segments of our population. Indeed, at the onset of the COVID-19 pandemic, the World Health Organization had predicted a doubling of malaria deaths in the event of severe disruptions to the distribution of insecticide-treated nets and access to anti-malarial medicines. I am, however, delighted to say that the predicted doubling in malaria deaths was averted in our African countries. Malaria deaths have been contained through door-to-door distribution of 160 million insecticide-treated nets, indoor residual spraying, and through the administration of seasonal malaria chemoprevention for children. All of this has been done while strictly adhering to all COVID-19 protocols. But the fight, ladies and gentlemen, is yet to be won. Indeed, far from it. The World Health Organization, through their World Malaria Report 2020, states that Africa continues to bear more than 90% of the global malaria burden, and that progress in reducing malaria infections and deaths has been slowed, especially in high-burden countries. We, however, are still off track in achieving the ambitious targets that we set for ourselves in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. The COVID-19 pandemic has demonstrated the centrality of a robust healthcare system which provides universal access to all populations. Additionally, as African nations, our social economic recovery will also depend on our ability to innovate and generate solutions to issues such as malaria, issues which have for long bedeviled us. Africa must increase her capacity for local manufacturing of malaria commodities in a similar manner that we are now producing personal protective equipment for our own use. The spread and the development of the COVID-19 vaccine and the sharing of real-time data to inform decision-making provide instructive lessons for us in our efforts to eliminate malaria by 2030. I am confident that through working together, we can do it. And so I therefore urge my fellow leaders to champion the following actions in your respective nations. The first of these is to increase coordination and engagement on the elimination of malaria through regional economic communities. The second is to expand access to quality health care through national malaria scorecards to inform and to empower individuals and communities to take individual action. The third is to establish national end malaria councils and funds to convene senior leaders across all sectors to champion malaria and mobilize action, resources, and also to drive accountability. And fourthly, to recruit and mobilize a new generation of youth to combat malaria. I take this opportunity to congratulate the African Union member states for the demonstration of unwavering leadership towards the elimination of malaria by 2030, and in particular, the 19 countries that have launched and rolled out the Zero Malaria Starts With Me campaign, and I urge other countries that have not yet done so to launch the campaign as soon as possible. Let me also take this opportunity to thank the Global Fund for the financial support to the African Union member states, which enabled them to avert the predicted doubling of malaria cases on the African continent. Your Excellencies, members of the press, ladies and gentlemen, I now take this opportunity to launch the ALMA Scorecard Hub. This new platform will allow countries, as well as our development partners, to access information about scorecard management, tools for action, and accountability for malaria, reproductive, maternal, neonatal, child and adolescent health, and neglected tropical diseases. The scorecard is currently in use in over 40 countries and keeps track of progress of key health indicators to inform and empower health workers, local governments, and communities to act. Between 2012 and 2020, ALMA has supported over 80 national scorecards for malaria, neglected tropical diseases, reproductive, maternal, neonatal, child and adolescent health, nutrition, as well as several community scorecards. The use of the scorecard tool has had significant impact, with countries using real-time data to respond to outbreaks, shortages of staff or commodities, and improving quality of care. Scorecard tools have also facilitated increased financing and increased political engagement and accountability in matters health. The launch, therefore, of the ALMA Scorecard Hub is a key step in African countries' efforts to drive accountability, to achieve the bold targets set to eliminate malaria by 2030, and improve maternal and child health across our continent. I strongly encourage my fellow heads of state and government to publicly share their scorecards to their citizens through this hub. Your Excellencies, members of the Fourth Estate, ladies and gentlemen, the youth on the African continent constitutes more than 60% of our population and are a central asset to the social economic transformation that we desire for our continent. As such, increased participation and leadership by the youth is fundamental to the success of any program. In this regard, today, I am also pleased to launch the ALMA Youth Army Strategy, we shall provide a framework for engaging our youth across the African continent and develop a continental ALMA youth army for malaria elimination and contribute to the broader health and development agenda of our continent. The vision is to encourage our youth across Africa to advocate and drive action towards malaria elimination and the expansion of universal health coverage. The mission is to provide a platform to build a Pan-African movement of young people involved in the fight against malaria and other health priorities through advocacy, communication, and evidence-informed action. Let me conclude my statement by reiterating my own personal commitment to advance the malaria agenda in line with our continental commitments. Zero malaria starts with me, with you, and with all of us together. I thank you.